Have you ever just, stared at a medicine cabinet and seen that whole mix of tablets, capsules, liquids, and creams? They all look so different, but they have one thing in common. They're designed with incredible precision. So let's get into it and uncover the science behind why a pill is, well, a pill.
I mean, seriously, wouldn't that be easier? Why go through all the trouble of pressing it into a pill or mixing it into a syrup? Well, it turns out that raw powder on its own would in many cases be completely useless or maybe even dangerous. And when you figure out why, you start to see the brilliant engineering that's hidden in every single dose of medicine.
To really get it, we need to stop thinking about a medicine's form as just packaging. It's so much more than that. You got to think of it as a functional, protective shell, like a high-tech delivery system designed to make sure it actually works.
And look at all the jobs this shell has to do. First off, it makes sure you get the exact right amount of medicine. Not too much, not too little. It's also like a shield, protecting the drug from getting ruined by plain old air or moisture before you even take it. It can hide some truly awful tastes, and this one is crucial. It can protect the medicine from your own stomach acid so it can get absorbed where it's supposed to. It's what allows for different delivery methods, and it can even be designed to release the drug slowly over hours and hours.
Okay, so if the form is this amazing delivery system, what's it actually made of? It's time to kind of pop the hood. Let's break down the basic anatomy of a medicine to see the building blocks you'll find in pretty much any one you ever come across.
The official sciencey term for all of this is dosage form. And it's really simple. It's just the vehicle, the medium, that carries a drug into your body. Doesn't matter if it's a solid pill, a liquid syrup, or a cream you rub on your skin, it's a dosage form.
And every single dosage form has two key parts. First, there's the active pharmaceutical ingredient, or API. That's the drug itself, the chemical that actually does the job. But the API is almost never by itself. It's mixed with what are called excipients, all the non-drug stuff. Think of it this way. The API is the important message, but the excipients are the envelope, the paper, and the ink that make sure that message gets delivered safe and sound. They're the helpers.
So now we know what they're made of. How do scientists even begin to organize all these different forms? Well, the most straightforward way is to start with the real basics. Their physical state. Is it a solid, a liquid, or, something in between?
And this table lays it out perfectly. You've got your solids, right? Things like tablets and capsules. They're usually the most stable and just plain easy to handle. Then you have liquids like a syrup or a solution, which are great when a drug needs to be dissolved to work right. And then you have the semi-solids, your creams and gels, which have that awesome quality of staying put but being easy to spread around. And we can get even more specific. Even inside that solid category, there's a key difference. A unit dose is what you probably think of, a pre-measured amount, like one single pill. But a bulk dose is something like a powder, where you actually have to measure out your dose from a bigger container.
Liquids have their own little quirks too. Some are what we call monophasic. Everything is completely dissolved into one single clear liquid, like a simple syrup. But others are biphasic, and they look more like a milky suspension. That's where you have tiny solid drug particles just floating in the liquid. And you know what? That's exactly why you often have to shake those ones before you use them.
But just classifying by physical form, that's only half the story. The state of the medicine, whether it's a solid or liquid, is often decided by something way more important: how and where it's supposed to get into your body. This is called the route of administration.
See, the route really determines the form. It just makes sense, right? If you need to swallow a drug, you're going to get an oral form, like a tablet. If it needs to go on your skin, you'll get a topical cream. For your lungs, it has to be an inhaled aerosol. And for injections, what we call parenteral routes, you need a perfectly sterile solution. And for the eye, you need a super specific ophthalmic form, like eye drops.
And the list just keeps going, getting more and more specialized. There are tablets designed to dissolve right under your tongue for super fast absorption. There are dosage forms made specifically for rectal or vaginal delivery, or even odic, that's in the ear, delivery. Every single route is a unique environment, and the dosage form is engineered to handle it.
So, what does this all add up to? We've talked about solids, liquids, all these delivery routes. It all comes back to a single, really powerful idea that ties everything together.
And this is the main thing to remember. The shape, the state, the ingredients of your medicine, none of it is an accident. It is a deliberate, incredibly sophisticated scientific design. That pill isn't just a pill. It's a tiny, high-tech delivery vehicle engineered from the ground up to protect its cargo and get it to the exact right spot in your body at the right time so it can do its job. So here's what I want you to do. The next time you open a bottle of medicine, just take a second and really look at it. Is it a coated tablet? Well, maybe that means it needs to survive a rough journey through the stomach. Is it a thick, sticky syrup? Maybe it's designed to soothe your throat on the way down. Ask yourself, what is its form telling you about its function? Because now you know how to read the signs.